Welcome to Healthy Lifestyle Tips, where we bring you insightful information to help you live a healthier, happier, and more fulfilling life. Today, we are going to discuss a topic that is often overlooked but is essential in family planning: birth control for men, specifically vasectomy. Vasectomy is a surgical procedure that is done to prevent the release of sperm during ejaculation. It is a permanent form of contraception and is an effective method of birth control. The procedure involves cutting or blocking the vas deferens, the tubes that carry sperm from the testicles to the urethra, where it mixes with semen during ejaculation. Now, you may be wondering, why would anyone want to undergo such a procedure? Well, there are many reasons why men may choose to have a vasectomy. Firstly, it is a reliable and permanent form of contraception that does not require any ongoing maintenance, unlike other forms of birth control. This can be particularly beneficial for couples who have completed their family and do not wish to have any more children. Secondly, vasectomy is a relatively straightforward procedure that can be done on an outpatient basis, with a short recovery time. One common misconception about vasectomy is that it will negatively affect a man's sexual function. However, this is not the case. Vasectomy does not affect a man's libido, ability to have an erection, or the sensation of orgasm. In fact, many men report an improvement in sexual function after the procedure, as they no longer have to worry about the possibility of an unintended pregnancy. It is important to note that vasectomy is a permanent form of contraception, and while it is possible to reverse the procedure, the success rate of reversal is not guaranteed. Vasectomy is a surgical procedure used to reverse a vasectomy. It involves reconnecting the vas deferens, the tubes that were cut or blocked during the vasectomy, to restore the flow of sperm. The procedure is typically performed under general anesthesia and can take several hours to complete. During the vasectomy procedure, the surgeon will make a small incision in the scrotum to access the cut ends of the vas deferens. The surgeon will then examine the cut ends of the tubes to determine the feasibility of reconnecting them. If the ends of the vas deferens are healthy and there is enough length to work with, the surgeon will attempt to reconnect them using a microsurgical technique. The microsurgical technique involves using a high-powered microscope to magnify the surgical field and allow for precise suturing of the tubes. The surgeon will carefully align the ends of the vas deferens and then sew them back together using very fine sutures. Once the tubes are reconnected, the surgeon will check for any leaks or blockages in the tubes to ensure that the flow of sperm has been restored. After the procedure, the patient may experience some pain, swelling, and bruising in the scrotal area, which typically subsides within a week or two. It may take several weeks for the patient's sperm count to return to normal, and it is important to use alternative forms of contraception until the sperm count has been confirmed to be sufficient for pregnancy. It is important to note that the success of vasectomy depends on several factors, including the length of time since the vasectomy was performed, the technique used during the initial vasectomy, and the patient's age. Generally, the success rate of vasectomy is higher when performed within 10 years of the vasectomy and when the tubes were blocked using a clip rather than a surgical cut. Even under optimal conditions, however, there is no guarantee that the procedure will be successful in restoring fertility. Back to vasectomy. In terms of the procedure itself, vasectomy is a surgical procedure that involves cutting or blocking the vas deferens, the tubes that carry sperm from the testicles to the urethra. The procedure can be performed in a doctor's office or clinic under local anesthesia and typically takes around 30 minutes to complete. During the procedure, the patient lies on a table with their genitals exposed. The doctor will then use a local anesthetic to numb the area and make a small incision on each side of the scrotum. The vas deferens are then accessed through the incision, and a small section of each tube is removed or blocked using one of several methods. One common method is called conventional vasectomy, which involves cutting the vas deferens and then sealing the ends with stitches or clips. Another method is called no-scalpel vasectomy, where a small puncture is made in the scrotum, and the vas deferens are accessed using a specialized tool. The tubes are then cut or blocked using the same methods as in conventional vasectomy. After a vasectomy, it is common for the patient to experience some discomfort, swelling, and bruising in the scrotal area. This is a natural response to the surgery and usually subsides within a week or two. The level of pain experienced by the patient can vary, with some individuals experiencing mild discomfort, while others may experience more significant pain and swelling. The use of ice packs and over-the-counter pain medications can help alleviate these symptoms. In conclusion, vasectomy is a safe, reliable, and effective method of birth control for men. It is a permanent form of contraception that does not affect sexual function and has a short recovery time. If you are considering vasectomy, it is important to discuss the decision with your partner and make an informed choice. Thank you for watching. If you found this video helpful, please subscribe to our channel for more health and wellness tips.